Multiple sclerosis, or MS, is a chronic autoimmune disease where the immune system mistakenly attacks the brain and spinal cord. This can lead to a variety of symptoms, including vision problems, fatigue, numbness, and even cognitive difficulties. Traditionally, MS is diagnosed only after clear neurological symptoms appear. However, recent research from the University of British Columbia suggests that the disease may actually begin silently, up to 15 years before the first recognized symptoms. In a landmark study, researchers led by Dr. Marta Ruiz Algaro analyzed healthcare data from over 12,000 individuals in British Columbia. They compared 2,038 people with MS to 10,182 matched individuals without the disease, examining 25 years of medical records for trends in doctor visits and symptoms prior to formal MS diagnosis. The findings were striking. People who would eventually develop MS began using healthcare services more frequently, starting 14 to 15 years before their symptoms appeared. Interestingly, these visits were not initially for neurological issues. Instead, they were for vague symptoms like fatigue, pain, mental health concerns, vision issues, and musculoskeletal complaints. Notably, psychiatric consultations surged 12 years before diagnosis, particularly for anxiety and depression. This indicates a prodromal phase, a silent early period of disease, similar to what we see in conditions like Parkinson's or Alzheimer's. To break it down further, 15 years before onset, doctor visits for vague symptoms and mental health issues began to rise. 12 years prior, there was a spike in psychiatry visits, possibly due to immune-related inflammation affecting mood. 8 to 9 years before diagnosis, patients started seeing neurologists and ophthalmologists more frequently, likely due to subtle changes in vision or balance. 4 to 5 years out, visits for muscle pain, fatigue, and sensory disturbances became common. Finally, just 1 year before diagnosis, neurologic and musculoskeletal complaints sharply increased, often leading to the final workup that confirms MS. This research is not just about advancing science, it has real implications for patients. If mental health issues, vague fatigue, and visual complaints are the earliest warning signs, we could potentially catch MS years earlier, well before irreversible damage occurs. An earlier diagnosis means earlier treatment, which has been shown to slow disease progression and preserve quality of life. So, why does MS present this way? Researchers believe it's linked to early immune activation, possibly occurring outside the brain, affecting systems like mood regulation and vision pathways. Elevated inflammation markers, such as interleukin 6 and TNF alpha, have been observed in MS patients even before diagnosis, suggesting that subtle immune dysfunction may manifest long before traditional neurological symptoms emerge. The big takeaway here is that MS might not be a sudden storm. It could be a slow drizzle building up over years. This opens a powerful window for prevention, screening, and early treatment. With emerging biomarkers like serum neurofilament light chain and MRI imaging of central vein signs, we may soon be able to detect MS before significant disability begins. So, the next time you experience unexplained fatigue, blurry vision, or persistent anxiety, it's important not to dismiss these symptoms. They could be your body's earliest signals that something deeper is going on. Recognizing these signs could shift the timeline of diagnosis and ultimately change lives.